This looks like your typical doctor's office, patients checking in.
Sometimes they need someone to help them write their chart out.
Patient charts pulled.
And all of these cabinets represent a patient that's either come through the clinic, that's been seen on a regular basis, or somebody that just stopped through and needed help on one particular day.
Tests being run.
Okay, the last time you hear your blood sugar was 161.
Medical forms filled out. Until you take a closer look. Notice the address for this patient, woods by the railroad track. The majority of these patients are homeless. This is the Baptist Health Community Clinic at the First Presbyterian Church in downtown Little Rock.
It's been a wonderful 10 years. We've made a lot of difference in folks' lives.
It means the difference of life and death.
6 days a week around lunchtime, you'll see a line waiting outside the church. The church has been serving food to the homeless for over 40 years.
But we didn't have the skills, talents to take care of the medical needs. And then, 10 years ago, Baptist Health appeared and said, hey, we want to help. Every Friday, the great group of nurses come in and serve these people that sometimes are incoherent, sometimes high as a kite, sometimes really sick.
And they have the same feelings, the same emotions, the same things we feel. It's just that they don't have a home to fill that in. So you have to treat them as if, because they are people.
They don't look down at you. They treat you just like if you had $1 million.
They're always glad to see me, always help me in any way they can, Any questions I have, they answer for me.
Gary is just one of the 3,000 visits that the doctors and nurses have worked on over the last 10 years. Basic health care, and it's all free.
We see high blood pressure, diabetes. We see people with ankle or foot injuries, or somebody who's hurt themselves by a fall or a trauma who will just come in to get a look.
Some people need help and they be too scared to even ask for help or don't know what to do to get the help.
They are concerned. I mean, they are really concerned. They go out of their way to listen to the stories. They go out of their way to pat the hands.
And they're out here every Friday checking blood sugars, blood pressures, talking to these guys and ladies who show up here.
It's very fulfilling to be able to help somebody that sometimes can't help themselves.
They tell you that they appreciate you and thank you so much for what you've done for them. You know they mean it.
It's really a godsend knowing that people at Baptist actually care for the consumer, care even for the homeless people enough to offer free blood tests and blood pressure checks.
Some of the people we've been following for 3 or 4 years, and they're very intelligent people.
Well, I always come here to get my blood pressure checked, and the doctor, I'm fixing to see the doctor, and he also prescribes some blood pressure medication for me, which I'm taking, and so I like to keep an eye on it.
There are folks that walk every day that do not have access to health care, do not have access to housing, and all they want is help.
I would be a person in the cold because really you have to have medical insurance, and some folks can't afford medical insurance.
And the reason it's high right now because somebody stole my medicine, and stole my bag, my medicine was in it.
Everybody's got an interesting story, and in my opinion, everybody has a right to get some kind of medical care, to get some information on how to take care of themselves. And I feel that's an important thing to give these people who don't have it other places.
I mean, every time I leave here, I can honestly say I've truly helped someone that needed to be helped.
You get thank yous, I love you, you even get hugs sometimes.
I think it's a great outreach to the community.